As a patient, it's challenging to understand that in the current day and age, we don't have perfect tests to diagnose multiple diseases. Well, C. difficile is one of those diseases where there is no perfect test. And what you can see on this slide are a variety of different tests with different accuracies, termed sensitivity and specificity, for diagnosis of C. difficile. The overall way to think about the way that we diagnose C. difficile is to consider that we can either detect the toxin, the thing that's stimulating the symptoms that we as patients experience, and this would be the most accurate way to diagnose C. difficile, or we can detect the bacterium, the organism, and whether the organism is present. The problem with detecting the organism alone is that by detecting the organism, we don't know whether it's releasing the toxin. Therefore, the organism can be present within your system, but not releasing the toxin and not causing any symptoms. That is called the carrier state. The tests that are most commonly used by practitioners are either a combination of something called the enzyme-linked immunoassay and the GDH assay, or glutamate dehydrogenase assay, or the polymerase chain reaction, or the PCR. Let's first focus on the combination test. The combination test is a combination of the enzyme-linked immunoassay, a test that detects the presence or absence of the toxin, and the GDH assay, a test that looks for a chemical that is released in general by Clostridioides species. By combining these two tests, it increases the accuracy of our ability to detect C. difficile. The PCR is probably the most sensitive of all of our tests, but it only detects the ability of the organism to release a toxin. So it looks for the gene that codes for the protein of the toxin. The problem with that is that it can't differentiate whether or not the protein is being produced. Therefore, carriers with C. difficile, those that have C. difficile in their system who are not releasing toxin, will be positive, similarly to individuals who have the toxin within their system. So it's up to your practitioner to send these tests when most appropriate. In order to originally diagnose C. difficile, it's important that one of these sets of tests be sent, either the GDH assay plus the enzyme-linked immunoassay or the PCR. However, with recurrences, it is advised that the practitioner think clinically about how the patient you are presenting. And usually, it's not recommended that we recheck a stool assay to confirm the recurrence. The reason for that is that false positives, you being positive when you don't actually have the positive infection, are fairly high with these tests. So as you can see, diagnosis of this infection is a bit more complicated than just simply sending a single test. Suffice to say that your practitioner, the person that you're seeing to care for you, should think their way through the case and think their way through your symptoms and send the testing when it's most appropriate. It is typically most appropriate when you're presenting originally with C. difficile and when it's unclear whether you have an active infection again in the future or you have symptoms, such as diarrhea, from another cause, such as irritable bowel syndrome. By having an open dialogue with your practitioner and telling them all of your symptoms, this can help most in the diagnosis and confirmation of both an initial infection and a recurrence in the future.